Between Medicare for all who want it, the expandable Affordable Care Act, every Democratic champion is championing their own vision for the future of healthcare.
But Washington Monthly senior editor Phillip Longman has another proposal to add to the mix: Medicare prices for all. Joining us to explain his idea and more about the 2020 fight over healthcare is Phillip himself. Welcome to the show. Great to have you.
Thanks, B. Good to be here.
So just explain Medicare prices for all. What is the thinking behind this?
Well, the thinking is that we could all pay a lot less for healthcare without paying any extra taxes and without having to change our healthcare plans.
Okay.
And so how that works basically is everybody knows what Medicare is, right? Medicare has a process for determining how much it will pay for different healthcare procedures and services. It turns out that the prices that Medicare pays are, on average, about 60% of what those of us who have commercial insurance pay. And it's because Medicare has the ability to strike a hard bargain with providers.
Because a lot of people.
Right. Unfortunately, now we're in a world in which the major hospitals and other provider platforms are becoming more and more monopolistic.
Yeah.
So in most cities, there's only a single hospital system.
Right.
Which
or
means
a single insurance provider. Yeah.
Sometimes there's only a single insurance plan. But it means that whether it's an insurance company or a large employer that's purchasing health care, when they go to negotiate with the hospital's pretty much in the driver's seat. He's like the soup Nazi on Seinfeld. It's like, no soup for you, right? Unless you meet my price.
Yeah.
Right.
So that's why you're seeing this huge inflation in the cost of health care for those of us who have regular commercial insurance and aren't on Medicare. And so my thought, and the thought of some other people, is like, why don't we just say that Medicare prices apply to all health care, right? And if we did that, the first order effect would be that most people with commercial insurance would see a decline in their health care costs of about a third.
Wow.
Right?
Yeah.
And we could legislate to make sure that employers shared the savings that was coming with their employees.
Sure.
And so the political logic of this is it's not, unlike with a Medicare for all plan, you don't have to raise taxes to do this. And you also don't have to tell people they have to change their health care plan if they don't want to, right? It's also not inconsistent with having some kind of public option plan if you want that, right? But what it does is just instantly bring healthcare prices down. Now, the hospitals, some of them, will push back and say, well, we can't make a living on Medicare prices. But in point of fact, many hospitals do make a living.
They'd be able to figure it out. I'm quite confident.
Right.
You won't be able to play as many administrators.
But that doesn't get to, though, what do consumers actually pay? They're not really paying the prices of these procedures. They're paying their premiums and copays. So, why a lot of people, especially in the Democratic primary, have found Medicare for all so appealing. I covered earlier, a new poll of South Carolina has African Americans 82% support, even though they know, Sanders has been very upfront about, yes, taxes will go up for this certain group of people, but you will pay so much less because you won't have these massive premiums and copays. How do you deal with that part? Because it's not actually those upfront costs that most consumers are dealing with.
Well, many people on first hearing like the sound of Medicare for all, right? But then in focus groups and other more detailed polling, when it's explained that, oh, by the way, we need $36 trillion in new taxes. And don't worry because you'll save someplace else, right? And oh, by the way, we'll have to take away your choice of doctor. The politics of it
that part is
changing.
just not true. It's not about the doctors. It's just about
choice of healthcare plan.
People are not in love with like Blue Cross Blue Shield. They like their doctor, right?
Who's in that network?
They like their provider. So if you're able to still go to your doctor, that's not an issue. I also would just push back on the idea that the public is not informed on this. We've had nothing but debate after debate with industry point of view, talking points coming from the moderators, ads during the breaks that are industry funded against Medicare for all. Rahm Emanuel out with op-eds, it's going to be terrible, et cetera, et cetera. And yet the public still likes the idea of it because they like Medicare and they like the idea of everyone in the country having coverage that isn't necessarily tied to their employer.
Yeah. Well, again, people like it on first hearing. Bernie Sanders, home state of Vermont, tried to pass a Medicare for all plan, and he couldn't do it.
Well,
because people pushed back, right?
Well, let's get to the substance of what Krystal is asking you, which is that, how do you assure that something like this is even going to assume coverage? That's really what it is. How can you, what about this plan would expand coverage? Because right now it lowers costs for people with employer-provided insurance, but I mean, I'm sure you know this. What is it? 30 million people also still don't have health care in the current system. So would that cost trickle down, make it so that it's more accessible for people who are poor in order to buy into the system? How does that work?
Well, if you lower the cost of health care in the United States by a third, right, that's going to make it a lot more affordable. So right there, that's doing a lot on the access point. But there's nothing inconsistent to saying we can't have other programs to help people who can't afford health care for whatever reason, right?
Okay.
But the affordability, if you can't bend the cost curve, right, you're just constantly putting more money into a system that's already gobbling up all this GDP.
I don't think there's any disagreement on that.
Yeah, but I mean, the other way to get Medicare prices for all is to have Medicare for all, right? I mean, that's the other way to do this. And, you know, the other piece of this, though, is, and this is what we see, and you rightly point out at the hospital level, at the doctor level, at every level of the healthcare system, rather than incentivizing care, we're incentivizing profit. And so that's why you have skyrocketing costs and all these bizarre situations where one procedure will cost, you know, X here and X plus $1 trillion over here. That's why you have that dynamic. I'm just very skeptical that as long as you have a profit motive at the center of our healthcare system, that you're not going to have insurers gaming the system to deny care like they consistently do in order to maintain profitability, that they'll suck up the benefits of the reduced prices and not pass it on to consumers. That's the core of why Medicare for All is so popular, appealing to people, because they believe that it should be care at the center and not profits.
Well, okay, let's deconstruct this a little bit. What is Medicare for All, right? Does it eliminate profit motive? No, it doesn't. Hospitals are still in the business. They're private enterprise things, right? Some are for-profit, some are nominally non-profit, but they're in the business of maximizing their revenues, right? That's where most of the money in healthcare goes, right? Medicare for All is really kind of like a corporate welfare program for giant healthcare providers. It says, we'll subsidize the cost of your consumers, right? Making it possible for you to raise your prices.
I'm not an advocate for Medicare for All, but I mean, I want to be fair to the people who propose it, which is that they do address this through anti-monopolistic concern against healthcare companies and in terms of the price fixing and all that. So, I mean, would a hospital really be able to? I mean, you can tell me, is it true that in a Sanders or a Warren Medicare for All plan that they will face no barrier to price? They will have total ability to set price with the government? I find that very difficult to believe.
Think about defense contracting.
Sure.
Okay, what is defense contracting? We have private sector players who are sole source providers, right? Who negotiate prices with the federal government for what we're going to charge for an F-35.
Right.
That's the same power dynamic that exists from a Medicare for All program and an individual hospital that's monopolized, say, all healthcare in Western Pennsylvania.
Right, but I mean, you could also just use monopolistic, anti-monopolistic laws in order to go after the defense contractors and to affect price.
You could do that.
I don't know why that isn't. I don't know why this is mutually exclusive. That's what I'm asking you.
Well, they're not mutually exclusive, but one is politically much more difficult than the other, right? And in an ideal world, we could have a Medicare for All program combined with rigorous antitrust against that. That would be great.
Right.
But it's not working.
You're speaking politically.
Isn't Medicare prices for all? I mean, doesn't that face the same problem?
I'm sorry? What?
Doesn't the idea of Medicare prices for all, doesn't that face the same challenge of
it doesn't. Like, for example,
government negotiating?
In Elizabeth Warren's healthcare plan, and I love Elizabeth Warren, right? But it's got one paragraph in her plan about, well, we'll be more rigorous on antitrust enforcement going forward, but we won't break up any existing hospitals. Well, existing hospitals are highly monopolized. They're so highly monopolized that no politician can stand up.
I think hospitals are the biggest criminals in this entire system. Here's one thing that I do sympathize with the Medicare for All crowd, which is that if you propose this, it's just as much as an existential threat to their bottom line as Medicare for All, and they're going to spend hundreds of billions, if not trillions of dollars fighting you. So politically, is it that much more expedient than a Medicare for All? As in, would it be, in my mind, it'd be just as hard to pass this as it would be Medicare for all.
And way more
It won't be easy. If it was easy, we would have done it a long time ago.
Right.
Yeah.
Right? And yes, you will have a fight with providers. Not all providers, but the big monopolistic providers, right? But you don't have to come to the American people and say, we need to raise your taxes by $36 million. And you don't have to come to the American people and say, you have to give up your existing health care plan. You don't have to go to unions and say the long fight that you had for that health care plan, it's all moot now, right? You don't have to go to employers and say all the benefit you think you get by providing employer-provided health care, you don't get to do that anymore. So it's a completely different order of battle, right? And it's not easy.
Right.
It's not easy, but frankly, every other peer nation we have out there, France and Germany, they have essentially the same proposal that what I'm talking about, right? They have a private sector that provides health care. They have, in the case of Germany, and private insurers, right? But the competition isn't over price. The competition is over who can provide the best service, right? Most of the energy in our healthcare system now goes between people on two sides of the negotiating table trying to shove prices off onto the other guy, shove costs onto the other guy. If you take this approach, just take prices off the table, then competition still exists. But all these resources are freed up to concentrate on healthcare concept, right?
So on the other hand, you do have to go to the American people, though, if you aren't providing care to everyone and say millions of you still aren't going to have coverage. So I think that's one of the big trade-offs here. But it's a very interesting proposal.
Yes, thank you.
I think you've raised some important questions. Thank you so much for being with us.
Thank you. Take care.
Next on Rising, imagine being extorted and terrorized by someone hacking your security camera, and then the company blames the intrusion on you. We're going to explain more. That's next.